Hello, this is Dr. Vineela, Consultant Pediatrician at Treatment Range Hospital, Kukatpalli. So today, let's discuss about urinary tract infection. What is urinary tract infection? It is most common in young children. That's why it is today's topic. Urinary tract infection is the infection of urethra, urinary bladder and kidneys. So why it is important? The urinary tract infection, if it is not treated adequately, it can lead to irreversible kidney damage. So that is why we have to treat the urinary tract infection. So coming to what are the signs and symptoms of urinary tract infection, it is most common among girls compared to boys because the girls have short urethra, that is being the reason. And what are the symptoms? Child will be having a fever with chills and rigor, and also vomiting, diarrhea, crying or pain while passing urine, and also abdominal pain or abdomen distension. These can be the signs and symptoms for the child with urinary tract infection. So what are the risk factors? Risk factors for urinary tract infection. It can be because of poor perineal hygiene and improper toilet training. As we discussed before, girls have more chances compared to the boys, and any congenital anomalies of the kidneys, or especially in boys having phimosis, this can all be the risk factors for developing urinary tract infection. So how do we treat them and how we diagnose that the child is having urinary tract infection? Coming to the investigations, if the urine microscopy is having pus cells more than 6, or the urine culture is showing any microorganism growth, that can be diagnosis for the urinary tract infection. And how will we treat? If the child is stable and with adequate hydration, the child is well active, then we will treat it at the home. But antibiotic treatment is necessary for the urinary tract infection treatment. So we will divide into the OPD treatment or the hospital admission. While OPD treatment, we will give just the oral antibiotics with telling proper hygiene and good hydration. Which children will need the hospital admission? If the child is less than 6 months, or the child having low BP, or the child is not active, playful, not taking foods, then they will need the hospital admission and they will need the IV antibiotics and also IV hydration. So what is the definition of recurrent UTI? If the children less than 5 years having two episodes of urinary tract infection, then we call it as recurrent urinary tract infections. And what are the investigations? Rather than the blood test, what are the investigations to be done on follow-up? We can do ultrasound abdomen and pelvis to rule out any congenital anomalies in the kidneys. And next we can do scans like MCU, DMSA scan, DTPA scan. These are done in the follow-up in the urinary tract infection. So today we have discussed all the signs, symptoms, treatment and everything. So what is a take-home message for you, especially for the parents? You have to give proper toilet training. If the child is constipated, then also it can be the reason for causing recurrent UTIs. Proper toilet training, proper perineal hygiene. You should wash the child's perineal area with soap and water. And just the gentle wash. And good hydration for the children. Unnecessary diaper usage. You should prevent the unnecessary diaper usage. So these are all the take-home messages to prevent the urinary tract infection.